And developing now, many of those deaths from the water crisis were linked to Legionnaire's disease in Flint. The majority of those traced to McLaren Flint. Tonight, we have some new information related to the hospital's decade-long history of Legionella growth in their facility. The CDC says it started well before the water crisis and continued years after. We first told you about this on ABC 12 News at 6. The CDC sent a letter to the state saying at least one, but possibly 5 people contracted Legionnaire's disease at McLaren Flint between 2018 and 19. We're going to turn now to our Ann Perrette, who joins us now live from the hospital. And Ann, that letter is dated December 2019. Since then, what's been done, and why wasn't this report made public in the first place?
Well, I gave the state health department and McLaren Flint 24 hours to respond after I received the letter. We first shared with you at 5 the list of recommendations the CDC asked the hospital to comply with. So where are we at with that? Did those changes happen? And 13 months later, is the hospital still considered at risk for spreading the bacteria? The December 2019 letter from the CDC to state officials says McLaren Flint has been a source of Legionella since 2008. That date is significant. Back in 2019, when the state health department linked new cases of Legionnaire's disease to the hospital claimed that all cases had been linked to when the city changed its water source. Last June, McLaren gave us this statement, quote, "We believe this order is unfounded and represents the state's continuous efforts to shift blame for their bad decisions made 5 years ago onto our hospital." 5 years prior to 2019 is 2014, when Flint changed its water source. Between 2014 and 2015, the state reported 90 cases of Legionnaire's disease and said most of those had a connection to McLaren Flint. Now, we've learned in the December 2019 letter, the CDC is saying McLaren Flint has been a source of contamination since 6 years before that, starting in 2008. In that letter, the CDC listed recommendations for changes the hospital needed to make to eradicate Legionella. We asked McLaren what they've done on this list in the past 13 months. The hospital wouldn't get specific, instead saying they're in compliance and regularly update the state on their water management program. A spokesperson issuing a statement saying in part, quote, "McLaren Flint maintains a stringent, highly monitored water management program. It was designed by some of the nation's leading water experts and is routinely reviewed by both internal and external environmental safety professionals." She added they've, quote, "had no further communication from the agency on this matter since January of last year." But the question remains, if the state initially told us about this potentially deadly risk in June 2019, why didn't they keep the public informed as more information came out? Neither McLaren Flint nor the state health department chose to answer. But a spokesperson for MDHHS did point out, quote, "No healthcare associated cases of Legionnaire's disease have been reported to MDHHS by McLaren Flint Hospital during 2020. And this new information now begs the question, did we see an uptick in Legionnaire's disease cases in Genesee County in 2014 and 2015 as a result of Flint's water source switch? Or did the switch exacerbate an already existing problem? I am working to get that answer. Stay with us as we can continue following this developing story. Live in Flint tonight, I'm Ann Perrette, ABC 12 News.
And thank you so much. This isn't the only Legionella outbreak Genesee